All right, welcome back. Man, time is flying today. Just becoming so educated on something I had no idea. I mean, I'll be perfectly honest with you. Dr. Olmos in the studio today from the TMJ and Sleep Therapy Center of San Diego. Until an hour ago, when we first met face to face, I really had no idea how big of an issue this was, how it worked, who it's affecting, the symptoms that it's creating, and ultimately the quality of life that it's costing people. I mean, this really is something that everyone needs to take a look at. And you need to ask yourself the question, how well are you sleeping? How well are you breathing?
Better question.
Right?
How well are you breathing?
Well, I think we kind of just, us laymen's, us normal folk, non-doctors, we think breathing is breathing.
Mm-hmm.
But yeah, I didn't even know that, breathing through your mouth was different than through your nose until I talked to you. But there's different qualities of breathing, and that's what you're trying to do. You're trying to help people achieve the highest quality of breathing to ultimately achieve the highest quality of health. Is that right?
Yeah, quality of life. I mean, that's what people want. There's a downside to medications in that, if you look at the damage to livers and kidneys from our polypharmacy, that means taking lots of drugs to manage our problems. When we don't look at origin, I don't know if that's really quality of life, So it's exactly what you said. It's about having, a healthier life and being able to do a lot of the things that maybe, you didn't think you could, because you'll be amazed at how your endurance and all these things come back when you are properly ventilated. And that's the whole thing. People just don't get it.
I really, really hope you can fix me up. I think we've identified that I've got some of the typical symptoms. I used to have, episodes where I'd stop breathing, and it was witnessed, it was noticed. The horrible, horrible nightmares, just terrible stuff that would come from lack of oxygen, to the brain while in sleep, and getting up at night on a frequent basis. As often as I wake up, I have to go to the bathroom. However often that is. If it's every hour, if it's every 2 hours, I have not slept through an entire night, and I can't tell you how long. And so I think it's pretty clear that I'm one of the people who needs to come see you and go through the process. So let's talk about what I need to do and kind of go step by step. So obviously I need to come get evaluated first and foremost. Tell me what that looks like. What do we do? What are we trying to achieve with that first visit?
Okay. Well, first of all, before you even arrive, we would send you a questionnaire, because we would want to know answers to questions that you may not think are related. Just as you didn't understand the relationship between having to get up at night to go to the restroom and this, well, there's all sorts of other markers like gastroesophageal reflux. People that get GERD is often related to breathing problems.
Well, what's that?
That's where you regurgitate acid into your mouth. Okay, so people have this kind of a problem, and
like heartburn. Does it feel like heartburn?
Yeah, but it actually get acid in your mouth,
okay.
And it can be to the point where it actually starts dissolving your teeth, the enamel of your teeth. So these are related to obstructive apnea situations. Sometimes, other times it has to do with what you eat. Wheat very often causes that kind of regurgitation. So, you have to look at the origin of these problems. But anyway, we do a comprehensive eval. We ask you these questions. You present with that, and then with that information and any medications or anything you've taken, because we need to know all the things that you ingest. See, a lot of times people don't think even vitamins or herbs or things that they take can affect their sleep. Let's say they're a little fatigued or they have depression, so they take St. John's wort or something else, but they're also taking antidepressant. They don't know that those things go together. They wouldn't know that grapefruit juice magnifies the effect of a lot of medications. So they might try to be healthy eating a grapefruit, but are doubling the dose of their medication because it inhibits your liver from metabolism. There's all kinds of things that we have to look at. And then when you come in, we do a comprehensive evaluation. We take your vitals. We look at orthopedic movement. We evaluate structures by palpation. We have a certain device called joint vibration analysis. We actually measure dynamically how your jaw moves to see if there's any perforations in your jaw or pathology that might exist. We use a CBCT, so we do an x-ray of your head so we can see what parts are obstructed or what other kinds of problems you may or may not have, and screen out and make sure that nothing's missed. Do a neurologic exam, everything, so that we've looked at all component parts of your problem, and then that way we can come to the best solution for you. We know what what areas that we need to emphasize.
Okay, so I come by for an eval. That takes what? How long does that take?
Oh, it would take about an hour and a half.
Hour and a half. Okay, so hour and a half, we get the full comprehensive exam.
Yes.
Then obviously you're going to need some time to evaluate all that.
No, we'll review it with you right there.
Right on the spot?
Oh, yeah, right on the spot. We'll review the tests and our findings. And if a sleep study is indicated, then we will write the prescription or work through your primary care or whatever insurance relationship you have. Or sometimes we have to write a letter to your primary care so that they would have a reason to know, because maybe they weren't checking you for these things or never asked you. Very often that is the case. And so we get you the diagnosis from a board-certified sleep physician, and then now we'll have the directive, and we do the triages to figure out, well, what's the best therapy for you.
Okay, so you need to do a sleep study. That's the next step.
Yes, the next step is a sleep study, yes.
What is the sleep study? I mean, what does that
Sleep
comprise
studies
of?
can be in a facility or they could be at home. We have ambulatory tests. People can go home with them. The most accurate are in a facility. You know, they not necessarily a hospital. Actually, they kind of look like hotel rooms nowadays. You know, a really nice bed. They even have TVs, which is kind of nonsensical. They want you to sleep, not watch TV. But they're very comfortable, and so they don't look like what you'd expect. The old hospital, white sheet and that kind of thing. So two ways to go on about that. That's determined by the sleep physician and the patient. Some people just cannot tolerate even the thought of doing that, sleeping over in a room. So there's machines that can be taken home and done in the privacy of the person's home.
Okay, so this machine, is it hooked up to your brain waves? Is it hooked up to your nose, or how does that thing work?
All the above.
Okay.
Brainwave activity is checked, nasal airflow, your pulse rate, oxygen levels, belts, little tiny belts on your chest and your abdomen to see if you're actually making the attempt to breathe. Sometimes people have a problem where, especially if they're on a history of medications for narcotics and things like that, where they actually stop breathing because their brain just cut out. And it's not because there's actually an obstruction. See, obstructive sleep apnea means you're trying to breathe, but there's something in the way, like a tongue or something else. And so we can measure all those things and actually determine what position that you're having these problems and also to what degree. So we're measuring any number of different things. All depends on the sophistication of each test that you do.
Okay, so we go through, and how long does that take, by the way?
One night.
Just one night?
One night.
That's it?
That's it.
Oh, okay. That's nothing. Here I'm thinking you have to do this for weeks to get all the information you need.
One night.
One night. So one night, we do that. That gets evaluated. And then what happens from there? You go into solution mode at that point?
Yes. You'll get a diagnosis, whether you have anything from an attempt to interruption of breathing, like upper airway resistance syndrome, to apnea, which is a cessation of breathing, suffocation. So we quantify that, mild, moderate, or severe. So, from 5 to 15, we'd call, mild. 15 to 29, we would call moderate. And over 30 is severe. That means how many times you stop breathing per hour. Now, a lot of people would say, oh, I'm only a mild apneic. And I say, oh, you're only a mild suffocator. So that's like being a mild cardiac person. You shouldn't feel good about that. You shouldn't feel comfortable that you only have a mild problem. You do have a suffocation problem, and that's never good. And if you suffocate 5 times an hour, well, that's a real health concern. And so that's why there's such a high risk of cardiovascular disease with suffocation. So this is why it should be addressed and quantified. Now, once they diagnose, from that, then we would find the reasons why that's happening, and we would address that and put together a plan that's best for you.
Okay. And that could include what are the different potential solutions for someone?
The traditional solution is ventilating you. That means a machine that puts air into you, a positive pressure device, or oral appliances, which have a much higher utilization. Probably the best treatment would be inflation. Problem is most people don't use them. They're in the garage or in the attic, but they're not, on the person's face, which is where they need to be. And it's really hard. Let's say you're a 30 or 40-year-old person, and you're going to have to go through the rest of your life with this machine blowing air into you. Now, a lot of people, like myself, myself would rather use an oral appliance, and that's what I use, and that works very effectively for a lot of people. Sometimes it's a combination of both. Sometimes we have to work with an ear, nose, and throat doctor, an otolaryngologist, to help fix the nasal obstructions in order to get proper. So again, each of those are identified for optimum breathing. Now, if you're a child, you see, you don't have to go through a lot of these surgical techniques. We can actually do them orthopedically, non-surgically, and get a better result because the person's growing. And once you have grown and your bones are solidified, then we have to be more aggressive about things.
Does a lot of it have to do with just people who can't breathe through their nose? It seems like
Huge.
More and more I'm meeting and knowing of people who they have broken their nose at some point, or whatever it is, and they can't breathe through their nose. Those little strips that got really popular, I don't know, was that
Breathe right strips.
Yeah, breathe right strips. They
Right.
got really popular like 5-6 years ago. I think
Can be beneficial to some people. It all
can.
depends if they have a condition called nasal valve collapse. There's the outer nasal valve and the inner nasal valve. And for those people, they're pinched. So even on our x-ray machine, we can see where the valve's pinched. We can see the people that would be benefited. So we use a technique called a Cottle's maneuver where we just lift up and we see if the person can get more airflow. And if they can, then they might benefit from that. But there's easier ways to do that because you can't put a breathe right strip on your nose every night. The skin peels off. There's much easier ways that we can build it into the oral appliances that we develop. In fact, I've had nasal surgery, but I still have a nasal valve problem. So I have a device, when I put it in my mouth, not only does it help me breathe through my mouth, but it helps me breathe through my nose better because I have a nasal valve problem.
Because of all those devices that you create are customized.
They're all customized for the person depending on what their needs are, yes.
Okay. Makes sense to me. Man, this has been totally eye-opening. I have to tell you, I really appreciate your time, Dr. Stephen Olmos from the TMJ and Sleep Therapy Center of San Diego. Thank you so much for being on San Diego Spotlight.
I appreciate
today.
it, Derek. Thank you.
Amazing stuff. I'll be seeing you soon in your offices. I'm telling you, this is, if you can help me get some sleep, I'm going to put you in my will. Okay.
Okay.
I'm not kidding. Again, this is live on the air.
There's a lot of people heard this, right?
This is live on the air. You're going to be in my will. If you can get me to some sleep at night, I'm telling you right now, I've gone a long time without it. I hope you can help me. Appreciate you.
Not a problem.
All right, great stuff. We'll be back again on Tuesday, same time, same channel, right here on ESPN 1700. See you then.